Steinberg.
When you monitor a patient, you never leave their side, especially after giving propofol. It's like leaving a baby that's sleeping on your kitchen countertop.
Joining me now in an Issues exclusive is that star witness for the prosecution, cardiologist Dr. Alon Steinberg. Dr. Steinberg, this is the first time you are talking about this case, about this extraordinary trial, about your testimony that most people conclude is what put Dr. Murray away, because you took extremely complicated medical testimony and you boiled it down to people terms that the jury and, by extension, those watching at home could understand. Your reaction, first of all, to this verdict?
Well, I think the jury decided the right thing and the proper thing. So I'm happy that my testimony helped out in convicting Dr. Murray.
What do you think this says to the Dr. Feelgoods of the world, the ones who are doing medicine as a money-making enterprise as opposed to a calling?
I think most doctors are doing it for a calling. I think that's a rare doctors of what Conrad Murray does. I review a lot of cases for the Board of California, and I've never seen such a extreme deviation from the standard of care. But I think it's actually a win for patient safety, but also a win for doctors. It just puts us on notice that we need to practice within the right boundaries of medicine. And it's already helped me in practice. Sometimes, just as you said, patients get medications from multiple doctors. I'm a cardiologist, but sometimes patients say, hey, you know, ran out of my Ambien, I don't have a follow-up with my primary for a while, or my back hurts, I need some Percocet. And this gives me some ammunition. So, you know, you really need to seek a specialist in that part of your medical care.
Michael's dermatologist, Dr. Arnie Klein, believes that Michael Jackson was totally addicted to propofol. Listen to this.
So he had problems with the propofol many times that I intervened, and I told him it was terribly dangerous, and he just had to stop.
If anyone at home wants to see more of Dr. Klein's exclusive interview, and I'm not choked up over his interview, believe you me, but you can go to HLN. TV.com. Dr. Arnie Klein said that he thought Michael Jackson was totally addicted to propofol, that he had tried to do 3 interventions. Dr. Steinberg, that means that other doctors out there were giving Michael Jackson propofol, that Dr. Conrad Murray wasn't the only one. Does that horrify you?
It's really scary. And part of that probably set up why Dr. Murray used it, because Michael Jackson knew so much about it. He said, oh, all these other doctors gave it, it's not a big deal, and it probably helped convince Dr. Murray to, do it also. In fact, in his testimony, there was another doctor that basically showed and taught Conrad Murray about how to give it overnight and used his office initially, and then Conrad Murray more or less learned how to do it and continued to do it, thinking it's not a big deal because all these other doctors are doing it. But as my mother said, just because everyone's jumping off a bridge, you shouldn't.
But does it scare you? I'm kind of scared that there are doctors out there, not just one, but more of them, administering propofol.
I don't think so. I think this was a very, very unique situation.
No, hold on. If somebody is doing 3 interventions on propofol, okay, that means that doctors, more than one doctor, is giving Michael Jackson propofol for the wrong reasons as a sleep aid. And he's getting this at different times, so it's different doctors.
You can pay a lot of money.
It scares me. Does it scare you?
You know what? I'm out there. I see physicians in my community. I review cases for the board. I've never heard of a case like this. This was really egregious. I want to assure you that, most doctors, all doctors almost, are moral and have a high standard of ethical care. This was just an extremely unusual case, so I want to reassure you that I don't think that will happen. But, in any profession, there's some outliers, and money and fame can sometimes buy anybody.
What was your most nerve-wracking moment on the stand?
I didn't have too much of a nerve. I prepared for the direct examination with David Walgren, and I prepared for the cross, and there wasn't a question that came at me that I didn't know was going to come at me.
So you weren't nervous?
I was very nervous before I came in, but I just thought of myself on a beach and laying around, and I walked in, and I knew most of the questions that were going to come at me, at least initially. So once I got a few questions out, I was very relaxed.
All right, well, let's listen to what defense attorney Ed Chernoff said during closing arguments about some of the things that you said, Dr. Steinberg. Check this out.
It was the most insulting possible thing you can say about Michael Jackson. As if this fully formed 50-year-old man was just a baby.
How much time? All right, you heard Ed Chernoff there.
Yeah, he took it out of context. What I was trying to show is that he was almost like a baby, like he was in a complete, utter no control. Because he was under the influence of propofol. So it was like leaving a baby on a table. I didn't mean to call him like he was, not an adult. I just meant that under Dr. Murray's care, it's like a parent to a small child. And leaving him on the table is like leaving a guy on a propofol and going to the bathroom a few minutes. It's just like the chance that you're going to leave your baby there and they're going to be sleeping and he may fall off.
Were you shocked when you heard what Dr. Conrad Murray had done by his own admission?
It was amazing. When initially I got the case, I got a lot of information. I got, the phone calls and the ambulance report and the doctor's report and the interviews. But the only thing I did on my report is actually look at the interview that he did with the detectives a couple days afterwards. And when I read that, I said, all the information is right there in his own words. And all I did in my report was just on that testimony or investigation, and that was enough.
Were you shocked by what he did?
I was really shocked. I couldn't believe it. I'm sometimes a little embarrassed that a physician would do that because it makes physicians look bad. But it was just unbelievable.
Of all the things he did, what was the most shocking thing that he did, in your opinion?
Wow, you know what? The most shocking thing, I think, is just not calling 911. I mean, holy cow. I mean, that's just the basics. When you don't have any help at all, and you're in someone's home, and you know that you don't have the proper equipment, you're not monitored, he's going to be in trouble if you don't get him intubated on a respirator. You got to call 911 immediately and get help.
Do you think if Dr. Murray had called 911 immediately, Michael Jackson might still be alive?
There was a lot of things. Yes. One, if he would have called 911 immediately, they were only about 4 minutes away. He had just found that he at least states he was only gone for about 2 minutes. He would have gone over, the EMS would have gotten there and probably resuscitated him because he found him with a blood pressure and he just stopped breathing. So when we put people to sleep all the time, people sometimes stop breathing and we are able to resuscitate them, but if we can't do it, we have a call button that calls people immediately to come and help us. He's in someone's home. He needs to call 911 immediately. But there's a lot of things, Jane. Also, if he would never have given propofol, never provided it, Mr. Jackson would be alive also. If he would have had any monitoring, would not have left his side, or had an assistant, he would still be alive. If he had the proper equipment there or some drugs, he would be alive. And if he would have even responded to the resuscitation himself, before he even called 911, he tried to revive him by using mouth-to-mouth. And we don't use mouth-to-mouth when we have a bag mask. We use oxygen and with an Ambu bag, and we try and push the oxygen into a patient to increase their breathing. He didn't do that. He started doing chest compressions on someone who had a circulation. He had a pulse. On the pulse oximeter, there was a heart rate. He was nice and warm when he found them, and the fact that he started doing chest compressions was a complete waste of time and counterproductive. So there were so many things that each one of those things, I feel Michael Jackson could have still been alive.
Wow. So really, he could have been here today if he had done any of those things.
I think absolutely. One is providing the propofol was horrible, and his actions were just inappropriate. He panicked.
Thank you so much.